One of the biggest drivers of medical waste and increased healthcare spending is also, unfortunately, an area that our new leader of HHS wants to expand, and that's Medicare Advantage. You might have seen over the years that groups like Cigna had to pay $172 million in 2023 for false claims. Humana and Aetna also had to pay millions in Medicare Advantage overpayments. And we're seeing that AI is being used to further worsen these overpayments. And when we look at this new CAP report, we see that overpayments from Medicare to Medicare Advantage plans could result in a waste of $1.3 to $2 trillion over the next decade. Now, what are these overpayments? In short, the way that a Medicare Advantage plan works is that Medicare has a benchmark amount that they pay for their beneficiaries, looking at traditional Medicare plus any supplemental coverage they buy. And they pay a monthly amount to Medicare Advantage run plans, which are run by private insurers like United Health Group and Aetna and Cigna and so on. But then at the end of each month, they do kind of a true up, an additional payment based on diagnosis codes, based on risk factors, based on star ratings and quality ratings and all these other things. And that's where gaming of the system comes into play. In fact, in 2024 alone, we find that overpayment was between 22 to 39%, resulting in $83 to $127 billion of overpayment. So what these insurance companies are doing is they're tying a bunch of diagnosis codes, the worst codes they can find. They're making patients look sicker than they actually are. And in up to 40% of the cases, they don't even have supporting documentation for these diagnosis codes. For example, they might take older adults who normally bruise easily. It's just something you see as you age. And they'll code it with some kind of complex thromboembolic condition without any supporting documentation for that. They'll do the same thing for clinical depression, diabetic cataracts, and there's no supporting documentation. And by doing these upcharging practices, they're able to then get a bigger payment. They're also selectively targeting specific people to enroll in Medicare Advantage. So a Medicare plan allows anyone with Medicare, any doctor who treats Medicare, the patient can go see that physician. Medicare Advantage has networks, kind of like any private insurance company or private plan does prior to Medicare. So one of the networks that they'll be really restrictive on is for cancer centers. That way they limit the amount of people that might need cancer, the people that are sicker, and they want to push those people more towards Medicare plans rather than the Medicare Advantage. Whereas they're going to offer benefits like free gym memberships to their members, knowing that the people that are most likely to take advantage of that are those that are already healthier and using a gym. And you can see over the past 8 years, 10 years or so, that Medicare Advantage overpayment from that selection bias and risk coding have raised dramatically. I mean, look at that. Now we're over that 80 billion mark combined between them, whereas we had, a comfortable 10 to 12 billion for the decade prior to that. And on the provider side, we don't like Medicare Advantage. It comes with a lot more administrative burden. It comes with a lot more prior authorization. It delays care, which also is worse for outcomes for beneficiaries. So all this to say, Medicare Advantage is not the answer. Expand Medicare Advantage would be a very bad thing for the U.S. health system, which is already struggling mightily in any statistic you look at, from the amount of costs to the health outcomes that we receive, the debt burden after the fact. So no, we do not want to extend Medicare Advantage plans.